Good morning, everybody. It is a great privilege and a pleasure to be here to open this session by the European Working Group of People with Dementia. We feel indeed that this is the most important session of the whole conference. To my colleagues, I want to say I'm so delighted that you have all found a way to join us and share your thoughts despite us not being here in person. I know the technology is not easy for us, all of us, but we have embraced this new challenge. As you know, this is my last year as chair. And when I began this, one of my old colleagues in the group said to me, remember, Helen, there are different personalities and different types of dementia. So it's not easy. So you just roll on and you listen. And you don't bother giving your opinion when people speak, because that way you will never get in trouble. So I've contributed the best I can. And I have also taken a leaf out of the book of Eva, our great chair of the board of Alzheimer Europe, who listens well. The European Working Group of People with Dementia began in 2012. It is comprising entirely of people living with dementia, nominated by their member association. As chair of the group, I've sat on the board of Alzheimer Europe. This is critical because it ensures the lived experience of dementia is heard at the highest level of the organization. We are all different. We come from all different walks of life. We support and empower each other through our work. The theme of today's session is the experiences of members during the pandemic and adapting after COVID-19. We are honored to have the following members speak via pre-recorded video. We have Angela from Austria, supported by Joanna, Gert from Belgium, Nina from the Czech Republic, Bern from Germany, Tomasz from Slovenia, supported by Patricia, Stefan from Sweden, supported by his daughter Jenny, Edelina from Portugal, supported by her daughter Alida, and Carl from Scotland, and Chris from Wales, both in the United Kingdom. There are many people who attend this symposium every year from different corners of the world. I'm sorry we are not together in person, but I'm so glad you're here. Now more than ever, it is critical we hear the voice of the person living with dementia. Please sit back and enjoy the presentations of these amazing people.
Vor dem Lockdown Mitte März war ich tagsüber nur selten daheim. Von einem Tag auf den anderen war es plötzlich vorbei mit meiner Freiheit. Es ist keine Kritik an den Maßnahmen, doch von nun an war ich allein zu Hause und fühlte mich isoliert. Trotzdem machte ich schöne neue Erfahrungen. Meine Nachbarn halfen mir beim Einkaufen und wir begannen Gespräche von Balkon zu Balkon zu führen. Durch Telefon, SMS und Videotelefonie waren solche sozialen Kontakte noch möglich.
Before the lockdown in mid-March, I was rarely at home during the day. From one day to the next, my freedom was suddenly over. This is no criticism on the measures, but from now on, I was alone and felt isolated. Nevertheless, I made new, beautiful experiences. My neighbors helped me with the shopping, and we began conversations from balcony to balcony. By telephone, SMS, and video calls, social contacts were still possible for me.
Zuerst war ich dankbar, mit welcher Ruhe und Gelassenheit meine Tage verliefen. Nach circa 3 Wochen stellte ich aber fest, dass diese Zeit der wenigen Möglichkeiten und ohne Anregungen gar nicht gut waren. Kein Gedächtnistraining, keine persönlichen Kontakte, keine Treffen mit Kindern und Enkelkindern, keine Besuche, keine außergewöhnlichen Situationen, nur gleichmäßig verlaufende Tage.
At the beginning of the lockdown, I was grateful for the peace and serenity with which my days passed. But after about 3 weeks, I realized that this time of few possibilities and without suggestions was not good at all. No memory training, no personal contacts, no appointments with my children and grandchildren, no visits, no unusual situations, just evenly distributed days.
Seit ich an Demenz erkrankt bin, lege ich großen Wert darauf, meinen Alltag übersichtlich, aber auch abwechslungsreich zu gestalten. Ich versuche, Dinge des Alltags nicht immer nach demselben Schema zu erledigen, indem ich zum Beispiel neue Wege erkunde und neue Fahrstrecken mit den öffentlichen Verkehrsmitteln plane. Raus aus der Routine ist für mich wichtig, denn so kann ich in meinem Denken beweglich bleiben. Aber was konnte ich jetzt verändern? Denn ohnehin war alles verboten und eingeschränkt.
Since I have been living with dementia, I attached great importance on, to organize my everyday life in clear but also varied way. I try not to always do things in everyday life according to the same scheme. For instance, exploring new paths or planning new routes when I use public transport. Getting out of the routine is important for my brain because this way I can stay flexible in my thinking. But what could I change now when everything was forbidden and restricted anyway?
Ich hatte nun viel Zeit zu lesen, wollte aber nicht nur unterhaltsame Bücher lesen, sondern suchte Literatur über uns Betroffene. Dabei stieß ich öfter auf das Thema Würde und stellte mir einige Fragen. Wie weit hängt Würde von meinen Fähigkeiten ab? Wie weit ist Würde und Wertschätzung gesellschaftlich von meiner Leistungsfähigkeit abhängig? Wie begegnet mir mein Umfeld, wenn meine Fähigkeiten nachlassen? Dabei habe ich bemerkt, dass auch Familie ihre Tücken hat. Meine Töchter zum Beispiel, aber auch andere Menschen, die mich von früher kennen, vergleichen mich oft mit meinem früheren Zustand, als ich noch gesund war. Verstärkt durch die Corona-Krise hatten sie offenbar das Bedürfnis, mich ganz besonders zu schützen und wollten mir alles abnehmen. Das hat mich sehr eingeschränkt und ich dachte oft, lasst es mich doch selber tun. Für mich ist Selbstbestimmung ein Teil meiner Würde. Ich denke, es ist wichtig, über den richtigen Umgang mit uns Betroffenen und unser Recht auf Selbstbestimmung hinzuweisen, auch in schwierigen Zeiten wie der Corona-Pandemie.
Now I had time to read a lot, but I didn't want just read entertaining books. I was looking for literature about us affected people. In doing so, I often came across the topic of dignity, and I asked myself some questions. How far does dignity depend on my abilities? To what extent is dignity and appreciation social dependent on my abilities? How will I be perceived by people if my abilities get lost? I noticed that family also has its pitfalls. My daughters, for example, always compare me with when I was healthy. Strengthened by the corona crisis, they obviously felt the need to protect me and wanted to take everything from me. This limited my life very much, and I often thought, let me do it myself. For me, self-determination is a part of my dignity. I think it is important to find a balanced way of dealing with us and to point out our right to a self-determined life, even in difficult times like the corona pandemic.
Leider merkte ich, dass meine Merkfähigkeit gesunken ist. Und ich lebe vermehrt mit Notizzetteln. Mein Gehirn muss wieder ins Arbeiten kommen und dazu braucht es ein paar Herausforderungen und ein selbstbestimmtes Leben.
Unfortunately, I noticed that my attention and my short-term memory has decreased. I have to write down much more and I live with lots of notes. My brain has to get back to work, and for that, I need some challenges and a self-determined life.
Auch jetzt empfinde ich meinen Lebensrhythmus nicht so, wie ich es von früher gewohnt war. Vorsicht spielt von meiner Seite noch eine große Rolle.
Even now, I do not feel my rhythm of life as I was used it in the past. Caution still plays an important role for me.
Mitte August habe ich mit meiner Tochter ein paar Urlaubstage in Hallstatt verbracht. Hallstatt ist ein kleiner Ort in Oberösterreich, der aufgrund der prähistorischen Funde üblicherweise von Touristenströmen aus Asien überrannt wird. Gäste aus dem Ausland gab es nun kaum. Jetzt nutzen Einheimische die Chance, sich in ihrem Ort zu bewegen. Sehr viele Menschen waren trotzdem in den engen Gassen unterwegs. Kaum mit Sicherheitsabstand, nur wenige mit Gesichtsmasken. Ich habe mich oft unsicher gefühlt und mich gefragt, was ich hier erlebe, auch wirklich eine gute Idee war. Ich spürte große Verunsicherung.
In the middle of August, I spent a few days in Hallstatt with my daughter. Hallstatt is a small village in Upper Austria, which is usually overrun by streams of tourists from Asia because of the prehistoric findings. Now there are hardly any guests from abroad. Now the locals take the chance to move around in their own town. Crowds of local people were walking in the narrow alleys, hardly with safe distance, often without face masks. I wondered whether what I was just experiencing was really a good idea or not. I felt uncomfortable and insecure.
Weil es nun immer noch wenig Abwechslung in meinem Alltag gibt, habe ich bemerkt, dass die Auseinandersetzung mit meinen Defiziten in gewisser Weise nun zu meiner Hauptaufgabe geworden ist. Andererseits ein wenig langweilig und nicht immer angenehm. Andererseits ist es auch gut, weil ich immer ein stärkeres Bedürfnis verspüre, anderen Menschen davon zu erzählen, wie es sich anfühlt, mit kognitiven Einschränkungen zu leben.
Because there is still little variety in my everyday life, I have noticed that dealing with my deficits has in some way become my main task. On one hand, this is boring and not always pleasant. On the other hand, the advantage is to tell other people about my life with cognitive disorders.
I sincerely hope that a second lockdown can prevent it. And I look forward to meeting you and again you in person.
Hi everyone, my name is Carol Hargreaves and I am a grateful member of the European Working Group. I come from Scotland, i.e. Glasgow, so I hope you can understand me. It's been a privilege working for the European Group as my time has come to an end after 4 years. I've been asked to talk about what it's been like for me personally with the COVID virus and being basically kept in the house. I live alone and I've been finding it quite stressful. I actually had a virus and was taken into hospital about 2 months ago. But they wouldn't tell me, they couldn't tell me if it was the COVID or not. But I did ask to get out of hospital because I was really unhappy. They weren't doing anything for me. So eventually they agreed to let me come home and at least I could get up and do wee bits and watch TV, have a cup of tea when I wanted. The staff are great, I must say. All my group were phoning me. The Scottish Working Group was phoning me when they heard that I was in hospital. As I say, I find it quite stressful because I have quite a busy social life. i.e. with the Scottish Dementia Working Group. I'm involved in a lot of things there, and I'm out most days, and I really, really miss the contact of all my friends. We call ourselves a family, and that's how we feel. It's been difficult being on my own because I like to talk. And anybody that's listening to this that knows me knows I like to talk, and I've basically been in here myself, and I didn't realise until this last week when my Wi-Fi went down. It was a technical problem, and I never had anything for 10 days. I had no Wi-Fi, no television, no phone, nothing. And that's when it really, I realised how lonely I was. George, my partner, he was great, going and getting me food and things like that, and just leaving them at the door. But the loneliness did hit me. I missed getting ready to go abroad to the European group because we loved it. We loved meeting all the group, and although, let me say, it was very hard work, but I think we done a lot of good work. Basically, we're back again down in lockdown, and I hope George doesn't get cat shagging because he's not really supposed to be here. But I got a letter telling me I have to stay in again for 14 days. I don't know if it's anything to do with the dementia. I don't know. So, but I've been very, very good sticking to what they've told us to do. It's been a very, very horrible, sad time for us. I have only got one sister, and my mother is 92. So it's been quite hard. She needs us about quite often. But my sister, she's a nurse, but she ended up getting shut in the house as well, and it was very, very difficult. We never saw her for over a month, and that was hard, even though we were phoning. But that wee time, we got about 2-3 weeks, things started to get whatever normal is. And here we are on Friday, everything gets shut down again. So we just have to go with it. But I must say, it's been a pleasure, and I'm ever so grateful to be part of the European group. I've learned so much. I've met so many new friends that I will keep in touch with. And I hope my part in it has been successful. So really, that's all I can say. It's it. Thank you very much, and goodbye from Glasgow.
My second new life, relax. My first life was stressful, too much stress. Every 14 days we had a deadline to finish something. We were working with a group, so our stress became bigger and bigger. But now I have a second new life without any deadlines, and I can be relaxed. I enjoy now drinking coffee, tea and beer, eating grapes from our own garden, meeting new people and friends without bothering by deadlines. Now time to relax and enjoying the life.
O aumento continuado do número de casos de pessoas com demência no mundo levou a que esta doença fosse considerada uma pandemia silenciosa. Viver com demência e cuidar de uma pessoa com demência é muitíssimo exigente. A pandemia do novo coronavírus é especialmente castigadora para as pessoas mais velhas. Quando as pessoas já têm uma idade avançada e padecem de doenças neurodegenerativas como Alzheimer ou outras demências, são especialmente vulneráveis à pandemia provocada pelo COVID-19.
The continued increase of number of cases of people with dementia in the world has led us to this disease being considered silent pandemic. Living with dementia and caring for a person with dementia is very demanding. The new coronavirus pandemic is especially punishing for older people. When people are old and suffer from neurodegenerative disease such as Alzheimer's or other dementia, they are especially vulnerable to the pandemic caused by COVID-19.
Sabemos que é muito mais provável que as pessoas com demência possam contrair a doença, porque têm um acesso muito limitado à informação verídica sobre a pandemia. Podem revelar dificuldades em compreender a mensagem e em recordar as medidas de prevenção e segurança para evitar o contágio, da importância de usar máscara e a importância de levar máscara e lavagem das mãos.
We know that people with dementia are much more likely to contract the disease because they have very limited access to true information about the pandemic. They may reveal difficulties in understanding the message and in remembering the preventive and safety measures to avoid contagion, like the importance of wearing a mask, hand washing, and others.
As pessoas com demência mais vulneráveis ao novo coronavírus são também fortemente afetadas pela alteração das importantes rotinas. Sair à rua para passear, conviver com familiares, vizinhos e amigos, frequentar o centro de dia.
People with dementia who are more vulnerable to the new coronavirus are also strongly affected by the change in their important routines. Going out for a walk, spending time with family, neighbors and friends, and attending to the day center.
No caso das pessoas que estão institucionalizadas, a restrição das visitas familiares tem consequências muito negativas. O isolamento social é especialmente nefasto para estas pessoas.
In the case of people who are institutionalized, restricting family visits has very negative consequences. Social isolation is especially harmful for these people.
É fundamental e urgente o apoio às pessoas com demência e aos seus cuidadores, de modo a protegê-los da pandemia do Covid-19, fornecendo-lhes apoio psicossocial.
Support for people with dementia and their carers is essential and urgent in order to protect them from the COVID-19 pandemic by providing psychosocial support.
As pessoas com demência, as suas famílias e os seus cuidadores enfrentam uma situação complexa e nova para a qual é necessário encontrar apoios de modo a mitigar as dificuldades. Como tal, encontrar várias formas de conviver com a minha demência, nesta nova forma de viver.
People with dementia, their families and their carers face a complex and new situation. For each, it is necessary to find support in order to mitigate the difficulties. As such, I found several ways to live with my dementia in this new way of living.
Durante o confinamento, criei, junto com a minha filha, um grupo online, em que partilhávamos experiências e terapias complementares. Tentei ao máximo fazer tudo que estava habituada a fazer no centro de dia que frequento. Assim, de uma outra forma, continuo bastante ativa, com a ajuda imprescindível da minha família.
During the confinement, I created, together with my daughter, an online group in which we shared experience and complementary therapies. I tried my best to do everything as I was used to doing in the day center I attend. So, in another way, I remain very active with the essential help of my family.
Ok.
Sim.
De regresso às minhas atividades diárias no centro de dia que frequento, Agora somos nós que damos o exemplo usando máscaras e tendo uma higiene constante das mãos e, sobretudo, cumprimentando os demais com cotoveladas.
Back in my daily life's activities in the day center I attend, now we are the ones who set the example, wearing masks and having constant hand hygiene, and above all, shaking our elbow with others.
Tentamos dar o exemplo de que os nossos problemas de memória não nos impossibilitam de ter novas rotinas tão importantes para a nossa sobrevivência, desde que nos habituemos a novas rotinas durante pelo menos um mês. É possível viver e conviver com demência nesta forma de viver.
We try to set an example that our memory problems do not prevent us from having our routines so important for our survival, as long as we get used to the new routines for at least 1 month. Is it possible to live and live with dementia in this new way of life? Thank you very much.
Thank you.
Obrigada.
Thank you very much.
My name is Bernd Heise. I was diagnosed with Alzheimer disease in 2016 at the age of 61. For a long time, we spent a calm life in the south of Germany, in Munich, until a disease called coronavirus came, and it looked like it will not leave us for some time. All over Germany, the spread of this disease started differently, but in the south where we live, it started very early. And within a few weeks, the world we knew changed severely. It was early spring and everybody wanted to spend more time outside. Sometime before, we had booked a trip to southern Italy for June. This was cancelled very soon by the tour operator. It will take place 1 year later, they say. At that time, we had decided to renovate our garden sheds. We have 2 of them. In fact, it was urgently needed to mend, or better, to completely recover the roofs. The roofs were there since at least 20 years and covered with a thin roofing felt that was worn out. It had holes and wasn't tight anymore. We went to the hardware store and bought a single packet of new tar shingles in the store. It was just for a test to see how good and useful they were. I wanted to make sure that this is exactly what we want before we would buy larger quantities. With that, we recovered a small part of the roof and of the hut. It looked good, and we concluded that this is what we wanted. Eager to finish that work, we went again to the store the next day to buy more of this material, but the store was closed from that day on, and all other hardware stores were closed as well. We felt that it was bitter to be stopped in the middle of work with a roof that wasn't yet probably covered against the rain. The end of the story is that we found in the internet some stores where we still could order what we needed, so we could finalize our project. However, this was just the beginning of a lot of changes we had to deal with. Personally, I had a hard time to learn all these new things. My daily routines had to change fast, and I had to remember all the new rules. This is a big problem for me and other people with dementia. I lose my confidence and I need more time for reflecting and adaptation. Here is my checklist, what to consider when I leave the apartment. Firstly, never forget the mask when leaving the house. Whenever we enter a shop, we must put on the mask. When we enter a restaurant, we have to wear a mask, but when we sit at the table, we can put it off. And don't forget to put on the mask when you are on the way to the toilet. In the subway and in the entire station, we got to put on the mask. Outside, we don't. People with a beard have to take special care that the mask fits tight. And the rules may be changed from time to time. Welcome to our new world.
I am Nina Balachkova from Czech Republic. I am fighting with the Alzheimer 13 years. How I spent my time during the lockdown. My grandmother used to say that everything bad was good for something else. After some years I agree with her. To me personally, the COVID and lockdown brought me more time to put in order some things at home and to go for long walks daily. Thanks to these walks, I finally know our surroundings better. Suddenly, my daughter called me every day. I think that main reason was to check if we, my husband and me, were really at home. When the COVID madness started, I offered my daughter that I would come to them and stay with them, as she has one schoolgirl, one boy, 6 years old, and a baby 6 months old. Therefore, she was very busy at that time. But she told me to stay at home and not to travel, as she lives in another town. Our other daughter was worried about us too. I was very surprised when the doctor from Czech Alzheimer Society called me in April and asked how I was doing. I was grateful and pleased with her care of me. When I was on a walk, my phone rang very often, as I supported also other, mainly old and lonely people. My husband told me that our home was like a call center. If one is active and keeps social contacts, there is no space left for feeling lonely or depressed. I realized again how important my family is for me.
Hej, det är Stefan från Sverige. Och jag är väldigt glad för att komma ut och träna både på gymmet men fast nu kan jag inte göra det när corona har trätt in. Under sommaren har jag kommit på en bättre och enklare träningsuppsättning.
As my friend and colleague Chris from our working group told me, Alzheimer's worst enemy is to do nothing. That motivates me and I want to do something and stay active, but in these times in new ways. Before the coronavirus, I loved to go to the gym and work out, but as we all know, the virus has changed a whole lot in our lives. For me, that is okay. I have learned to be used to change. Since my diagnosis with Alzheimer's, a lot of things has changed in my life. The thing that has not changed is me wanting to stay active. Although I can't go to the gym anymore, I have found new ways to stay active.
Och cykla är roligt, för det är också om man cyklar och man kan se vad som händer. Och man hinner med också vad som händer och jag tycker det är alltså som en helhet när man är ute och cyklar för man är så enkel och man behöver inte just hålla på och kämpa för att få ihop det utan cykeln tar man fram och stoppar in i förrådet och sen ut med det och jag gillar att åka motorcykel, sätter sig med det bak och så åker Karin runt och så jag sitter bak. Ja, det är roligt att åka fort och känna lite känsla och se vyer och se sjöar och hav. Och...
My wife and I started to go on bike rides together out in nature. I love the fresh air and the cardio it gives me. I have also found a new interest in joining my wife on her motorcycle. With this I can see new places in the area and it gives me the feeling of freedom.
Ja, jag ska säga att jag kan känna att ibland känner jag att man sjunker ner. Och då måste man ju hålla kvar i detta. Man kan inte bara sopa det under bordet utan man måste kämpa. Annars kommer vi inte hänga med. Och om man inte håller igång och tränar och ligger på hela tiden så går det fort ut. Så det är otroligt viktigt att hålla igång, annars kollapsar man och då är det kört snart. Därför måste vi hålla uppe detta och då kan man gå ut och cykla eller springa eller gå på gymmet. Jag tror att det är det bästa man kan göra. Mitt tips är det bästa att vara positiv och hålla sig glad och försöka träna och lyfta upp kroppen och känna att man följer med en upp fortfarande. Och det positiva det sprider sig till så många mer människor. Så håller man det positiva så kommer man att klara sig mycket längre fram.
Even if I miss the gym, I have found new hobbies. Things change, but when one door closes, another one opens. So be positive and creative with your life and stay happy and do something.
Moje ime je Tomaž, prihajam iz Slovenije, imam demenco. V življenju mi veliko pomeni dnevna rutina in jaz sem si svoje organiziral sam, saj sem pri zdravnikih dobil samo diagnozo in zdravila. Nihče pa mi ni povedal, kaj in kako naj počnem, da bom čim bolj ohranil svoje možgane.
My name is Tomaž, I come from Slovenia and I have dementia. The daily routine means a lot to me. I organize my own life because I only received a diagnosis and medication from the doctor, but no one told me what I can do to slow down the cognitive decline.
Zato sem se angažiral sam. Vsak dan imam neke aktivnosti. Ali se dobim s prijatelji, rad igram tenis, ping-pong. Vsak dan je rezerviran za nekaj drugega. Pomembno je, da se ne izločim iz družbe.
So I engaged myself. I have an activity every day. I meet my friends, play tennis, ping-pong and other sports. So every day is reserved for something different. It is important that we do not exclude ourselves from society.
V času ukrepov COVID-19 imam podobne težave kot vsi ostali. Velikokrat pozabim masko in se moram vračati ponjo. V času karantene mi je bilo najtežje, a nismo smeli nikamor, saj sem zelo rad v družbi.
During the COVID-19 measures, I had similar problems as everyone else. Many times I forget the mask and I have to go back for it. During the quarantine in spring, the hardest thing for me was not being allowed to go anywhere or socialize because I really like company.
Moje sporočilo je, da je pomembno, da ostanem aktivni ne glede na situacijo.
My message is that it is important to stay active no matter the situation. Thank you, everybody.
Thank you.
So my life during COVID, what was it like? Well, when COVID struck, I felt locked up and locked down. It was a huge change to my life. Up until March, my volunteer work as an international dementia advocate took me all over Europe. There were events in Malta, conferences in Portugal, meetings in Brussels, and speeches in London. Initially, it was a complete culture shock. I was at home in Tubbercurry in rural northwest of Ireland in Sligo, all day, every day, and I found it very hard to create a new outcome. My husband is ill, so we were strictly at home, cocooning as it is called in Ireland. I found it so hard to adjust. I used to be so busy preparing speeches, reviewing meeting documents, planning trips, working out travel arrangements, and considering what to wear. And my house was always busy. I love people. I love having guests because it brings me great joy. But the lockdown came silence, and the guests were no longer coming. So all I had was silence. I found the days were long. Some days I got in my car when I should not have, may I add, and drove for a change of scenery because I couldn't cope with the silence. Initially, I thought this break will be good. But as time went on, it seemed never ending. I wondered, would I ever attend another meeting? After the initial few weeks, advocacy work began again. I became what is called a Zoomie, having online meetings. But working only online was a real challenge. The technology was tough, but I also missed the human interaction. I'm a peaceful person, so looking at a screen is not the same as speaking to a person. I was glad that I could have a sense of purpose again. There was also an adjustment on how the work happened. There would be a burst of engagement from lots of phone calls and then back again. It's harder to plan my advocacy work because we're not really sure. Could have no visitors and had someone to do my shopping. This was very hard. I missed the independence of picking out my own shopping, and I did not like being dependent on others. Since getting my diagnosis, I've been a campaigner, and I had a view of myself as an independent, dynamic person, not stuck at home getting my shopping delivered. This is not Helen. And I was frightened because I could feel my memory deteriorating. The longer you're around doing nothing, your memory gets worse. I had no routine or structure, and I was stressed. So that's the bad news. So what helped me during COVID-19? Well, firstly, I found that I had great personal resilience. I've been through hard times before, and I had faith in myself, and my husband and son supported me to navigate these tough times. I think it is really important to have faith in yourself, but it is also important to reach out. I found keeping in touch with people at home and abroad in the same space as myself was comforting, and I connected with lots of new and old friends. I also took time for myself. I know when caring for a person, it is important to look after yourself, and so I did that. I refueled. I got a Labrador puppy called Lexi, and let me tell you, I don't know which of us has walked the legs of each other. I met so many neighbours and out walking. Lexi and myself were great fun. People really spoke to each other. Mums and dads pushing buggies. I'd never seen them before, but it was like old times. People were talking again. I also thought about my strategies. Living with dementia, living with dementia, I had lots of strategies, but I abandoned them. So I went back to my strategies. I began making shopping lists. I planned my day, and I made lists. I also made new COVID strategies to remember to wash my hands and social distance and wear my mask. I spoke to my son every day. I never FaceTimed so much, and that was an immense support. I was open with him and with my neighbours and friends that I was struggling. But I found when I was open, they were open too. This was not easy for anyone, and I think there is comfort in knowing that. My community came together and delivered gift baskets. Now that I'm an official older person, I got a lovely gift basket. People who did not have family were looked after, and there was a sense of togetherness. I needed that togetherness because there were times when I was scared my husband and I were going to die. But my community gave me support, and most importantly, it gave me hope. And all we need is hope. I believe older people paid a high price. We cocooned and stayed at home to ensure the health service was not overwhelmed. There was a lot of chat about protecting older people. But we protected everybody too. I kept well, and I kept out of hospital and ensured the health service It had enough more patients than it could manage. I stood in solidarity with healthcare professionals and my fellow citizens. I lit my candles in the window. I put my flag in the garden to remember them all. But I expect that solidarity in return. And I hope that young people stand with me as I navigate through COVID. Sometimes things happen in our lives that are unimaginably difficult. I feel I went through that during COVID. My husband became seriously ill, and in a reversal of roles, I became a carer. I couldn't visit him in hospital, so it was hard for him and a huge impact on me that I could stand waving at him 6 floors up. My son was in England. He could not visit for a while, and I felt so isolated, but resilience kicked in at all times, and I got on with each day as best I could. With the support from friends and family, Alzheimer's Europe and the Alzheimer's Society of Ireland, I made it through. I want to remind everyone that kindness matters. If you know someone who is isolated, please reach out. You can have a huge impact on their life. Remember, in times there's no such thing as a small act of kindness. So be kind. Mother Teresa said, spread love everywhere you go. Let no one ever come to you without leaving happier. Well, I hope, ladies and gentlemen, as this is my last time as chair, I brought some happiness to all of your lives. And I hope that you brought happiness to others during COVID. Here in Ireland, we share lots of laughter. We'll continue to laugh. Take care of yourselves and one another.